So we're surgeons. We know that we've sent people to Jenny Craig, Weight Watchers. They're not losing weight. They've seen the dietitian, they're not losing weight. Well, what else can we do for them because we don't want to do a knee replacement? Well, okay, well, maybe there's an operation that can help them. All of a sudden, there's this explosion on the internet recommending and offering bariatric surgery at multiple centres. So, does bariatric surgery actually help them lose weight? The short answer to that is yes, it does help them lose weight. The average weight across most of the studies was about 25 kilograms or a 9-point improvement in BMI. And that will help them with their knee replacement and their arthritis. And this is studied a couple of times. However, they neglect to mention that many patients put the weight back on within about 5 years. And that's the problem because they don't change what they're eating. 220,000 adult Americans have bariatric surgery annually. And the numbers in Australia are really, rapidly increasing. Are there any problems with bariatric surgery? Now, I'm not a bariatric surgeon, but I am a doctor and a scientist, and so I went to the literature to read about bariatric surgery. If I'm going to recommend bariatric surgery to my patients and send them to someone, I need to know about it. So another meta-analysis, grouped studies, complication rates of bariatric surgery, 10 to 17%, reoperation rates, 7%, and I love this, mortality associated with surgery is generally low. So 3 in 10,000 people will die from this operation to lose weight. And that's really, in my opinion, an unacceptably high statistic. What about kidney stones? Well, 1.73% times increase following a particular type of bariatric surgery. Now, a lot of people blame keto diets for kidney stones, but they don't mention it after having had bariatric surgery. This is really scary. 5 years after your bariatric surgery, your risk of suicide and self-harm increases, and it doesn't relate to the amount of weight loss. So you can be very successful with your weight loss, and you still have this risk of suicide and self-harm. What about diabetes? How durable is the diabetes remission? Well, this is fantastic. 72% experienced type 2 diabetes remission 2 years after surgery. What about at 10 years? Well, only 36% now are still not diabetics. Change your food, it's long-lasting. 68% experienced complete diabetes remission within 5 years. 35% of them redeveloped it. So again, another study which basically showed the same thing. What about the real physical complications? Abdominal abscess, recurrent aspiration pneumonia, that's when stuff goes into your lungs. And you can get all sorts of other physical problems. And these problems can develop almost regardless of which operation you have. You need to remember that these operations mostly are not reversible. So what happens in the long run? Well, you're at risk of getting micronutrient deficiencies, vitamin D, B12, calcium, iron. And the bariatric surgeons recommend monitoring yearly for the rest of your life to make sure that this doesn't happen to you. Every year, for the rest of your life, you've got to go back to them, and they've got to do blood tests and then give you supplements. And again, why would you do that when all you're trying to do is lose weight? Very busy slide, but this is again from the bariatric surgeons, from a centre of excellence, listing all the vitamin problems that you might have, which operation you might have, and how often you should be monitored looking for these deficiencies. So, remember the slide which I put up beforehand. Can I, in good conscience, as an orthopaedic surgeon, recommend bariatric surgery to my patients? I was faced with young patients who were overweight, and I didn't want to do a knee replacement on them because I knew what the complication rate was. But I also knew that everything that I had tried in the past had failed for these people. My wife has been low carb for a very long time, and so I tested it out on my family. And my brother lost 40 kilograms comfortably. But my parents, between them, if you add it up, lost about 20 kilograms. So we started trying it in the clinic, very small scale, and it worked. And the patients lost weight. And unfortunately for my surgical practice, they didn't need their operations. It reduced their MMPs. Do you remember that MMP goes into the cartilage and damages it because their livers were healthier? They increased their omega-3 ratios, which meant they had less inflammation, and they had less glycation end products. There are a number of patients that lost weight and then within a year or two came back and said, look, the arthritis is still bad, I need my surgery. But those patients now are normal body weight, not diabetic, not on antihypertensive medications, and haven't had irreversible surgery, which they need lifelong monitoring forever afterwards. So I have to say, next time you see or talk to someone considering bariatric surgery as the outcome for weight loss, and they're perhaps thinking about having some other surgery like a knee replacement operation, Paul and I can tell you, and the rest of the speakers can tell you, and I'm sure a lot of you have experienced this yourself, that this is a really easy way to change your lifestyle, to eat well, become healthier, and if you achieve the sort of body weight decreases that you see in the images of on the screen right now, you will see that your lifestyle will improve fantastically, and as we've heard from the other speakers, how much more enjoyable your life will be and how much longer you'll live. So I'd just like to encourage you all to enjoy this type of lifestyle and understand why, as an orthopedic surgeon, I got involved in the first place. Thank you.